between 1 to 3. We'll see no bleeding. And why the x-rays become so important is we can actually see this bone level going straight across here. Somebody who has gingivitis now just means that's a bacterial infection. You ever see the Listerine commercial and you see them swishing? It's right. They have you doing that because it's killing bacteria. So it's just bleeding gums. So when I drop down in here, I still get numbers between 1 and 3, but their gums just start to bleed. And that's what they're trying to show you. When I just touch that tissue, there would be some bleeding. But this bone level still goes straight across. Whereas periodontal disease, the actual destruction of bone, is caused by many different types of bacteria. So now when I take my ruler in here, it's going to start getting deeper, usually about 3 to 4 millimeters. We'll see about lots of pores. Again, be some bleeding when I touch that tissue. And here you can actually see that this bone, you can see a bigger space up in here. Our bone is starting to drop down here. So he's in a moderate category, Julie, just means that their numbers are usually going to be between 4 to 6. So typically about 5 millimeters. You can see a lot of bone has been eaten away there. See some puffiness here and bleeding again. And you can actually just see that bone dropping right around there. Somebody's in advanced stage, this means that their numbers are going to be 6 or greater. And what this tells us as a clinician, Julie, is that this person has lost about half their bone. But the reason why we screen all our patients is just because you have this much bone loss doesn't mean you're going to look like this. You've been coming, getting your teeth cleaned, and so most people look up in these stages because we've just been cleaning the top parts of the teeth. But if you have periodontal disease, then we actually have this bacteria that's sitting underneath here that we need to get cleaned out. So you may not even know that that's underneath there. So my job today is to actually screen you, which is just like getting your blood pressure taken. You get your blood pressure screened. A lot of people walk around, have high blood pressure and don't even know it. Periodontal disease is the same way. Until we actually go in here with our ruler and measure, you may not even know that you have periodontal disease. So I want to hear numbers between 1 and 3. Anything over 3, we'll pull this back out and see where you're at. Do you have any questions?
No.
Great. What was she doing the whole time?
Looking at you.
And what else? She was doing something else. What was she doing? She was nodding. We typically find that when you have engaged somebody, she's nodding. She's a hygienist too, so she was following, she's trying to listen. But there's a key components to this. We want to tell a laminate, the first thing we want to do is tell them we're screening them. Patients get that. They get blood pressure taken, they get a screening. If we're women, we get a pap screening. We're used to hearing this word screening. We hear it all the time. You know, men, same thing. Colon, you know, they're getting screening. They're getting their PSA screening. They understand that. So we want to tell them we're going to be screening you, and we want to let them know that it's a progression. Screening from healthy to gingivitis to periodontal disease. So that's kind of our introduction. Then we're going to go through and use each picture. And we're actually explaining that to them. So we're going to tell them the picture, what it is, the ruler, tell them what we see here, healthy tissue, and the bone. This is why I don't like this one. We have a better one, which you probably do in your book, because you can't really see the bone on this one, but we can get you a better one. And the bone level. And we just go through that, and we want to keep it simple, because what most people are doing, and I caught her doing it, she was doing it just a minute ago, she's reading this. So she really was only taking in probably 5 to 10% of what I was saying, okay? And that's actually why he's doing that, because most of us can't remember. And I do it different every time. To be honest, there is no set thing. There's just some general things we want to screen, and then we just want to go through each picture. And we really want to know what's said here because the patient is reading it while we're talking. So that's why it's important. We're going to tell them the numbers. So if they hear each number, 1 to 3, 4, 5, 6. We always want to explain this picture that they can have this much bone loss and not look like this. Why? Because when I see this picture, I'm saying, what? I don't look like that. Right. So we need to explain that. You may not look like this. You've been coming and having your teeth cleaned, which we just clean the top part. But if we have an infection underneath there, then all that is remaining underneath there without us knowing. And then we want to sum it up so that they know what to hear for. So you want to hear numbers between 1 and 3. I'm going to call my assistant in. She's going to record those numbers. If we get anything over a 3, we'll take this out and decide where you're at. Do you have any questions? And that's really important. I cannot start to probe until I ask my patient, do you have any questions? Because they may say, yeah, or I've had that done before, or I've never had this done before, or my gums always bleed. I need to know that. Yeah.
You can't really see much on that X-ray.
We have a different one. We just had these copied, and I didn't realize that we grabbed them. You can tell it's like blue, so we'll get you better ones. Alright, questions about any of that? Alright, we're gonna pick a partner. Everybody's gonna partner up.